country, to be fair. Different countries have different tax laws, so with different vehicles. But from your point of view, at the sort of normal end, I'm not going to call it the low end because I'm in that boat as well. It's as tax efficient as you can get it. That's where you start. You use all the tax efficiencies and then you step up into different things.
Welcome back to the show. It's your girl Sarah right here on Relaks Radio. And I'm super excited to be here on this beautiful Thursday morning, all right? So if you're tuning in, let me know how your day's going. Let me know how you're feeling. You can text me and call me on 078-524-73473. Share your thoughts, share your opinions, because I would love to hear what you have to say, all right? Don't forget to text me. Don't forget to call me. The number is there below for you, and it's 078-524-73473, all right? Now, something else that you can actually do is you can like us on Facebook or follow us on Instagram, Twitter, and TikTok, and actually make sure that you're always informed about the very latest that happens, not just here in the United Kingdom, but in fact all over the world as well, all right? And that way you can actually make sure that you're always informed and updated about the very latest, and always make sure that you are sharing your thoughts, sharing your opinions with your friends, with your family, but also with us as well. And don't forget to download our app either, because that's available on both the Apple App Store and the Google Play Store, and it's available for free, right? Which means that, regardless of what you're doing, regardless of how busy you are, you can always, play our app on the phone and listen to the conversation, because that will definitely help you stay informed and updated about all of these different things that are happening in the world. And obviously at this point of time, there have been so many things happening in the world, and we're aware of it as well. The situation in Afghanistan, the wildfires, the earthquake in Haiti, so there's so many different things that are happening. And if you're someone who wants to stay updated about all of this, then Relaks Radio is the way to do that. So download the app, go follow us on our socials. That's Instagram, Facebook, Twitter, TikTok, and even YouTube. And, get in touch with us. Text us, call us on 078-524-73473. All right. And now let's actually head into our conversation, because we're going to be talking about, chronic fatigue syndrome, right? And why exactly treatment for the chronic fatigue syndrome could actually be delayed. And this being delayed, what does it mean for all of these patients suffering from chronic fatigue syndrome? Why are they angry? We're going to be discussing all of that, all right? So if you have any thoughts to share, if you have any opinions to share, well, you know where to do that. It is Relaks Radio, because after all, Relaks Radio is all about your opinion. It's about your your perspective, and we honestly prioritize and we value your opinion and thoughts. So don't be shy. Just let me know what you're thinking, all right? Now, to actually head into our conversation, the National Institute for Health and Care Excellence has actually stated, or they've withdrawn rather, their long-awaited landmark guidance on the chronic fatigue syndrome, right? And this was asked before its publication, and this actually angered a lot of people who are suffering from the chronic fatigue syndrome, simply because of the fact that this would actually finally stop advising doctors to administer this controversial therapy, right? Now, I will get into what exactly this therapy is, but I want to very quickly talk about chronic fatigue syndrome, right? Now, it's something that is widely seen here in the United Kingdom as well, because currently there are about 250,000 people here in the United Kingdom who are affected by chronic fatigue syndrome, right? And essentially what that means is that, if you take, essentially what that means is that there are so many people here in the United Kingdom who suffer from this disease. However, more often than not, a lot of them are told that this is a situation that is there in their head, right? Essentially, they tend to downplay their disease and say, look, you know what, it doesn't actually exist. You're actually, imagining it. And the reason you feel this way is because you're physically inactive. However, even though that's the case, a lot of research has found that that is not true, right? This is not some psychological problem. This is in fact a problem that actually exists for a lot of people. right? And it's in fact a medical illness. However, a lot of general physicians don't know that. A lot of GPs aren't aware of that, and that is in fact, one of the biggest problems they have, because whenever they go to their general physician or with this medical condition, that they would always administer or prescribe a form of therapy that actually makes it harder for these patients to recover from chronic fatigue syndrome. All right, now charities and patient groups are in fact fighting for greater recognition of this, very poorly understood condition, right? And that's, like I said, that's because it's understood as a it's understood as a psychological problem rather than an actual medical illness, right? And a lot of these patients and a lot of these charities actually welcomed this planned guidance, because that was actually going to stop advising doctors to actually administer this controversial therapy. All right, however, obviously what happened was not that. And instead of this instead of this actually being published, it was actually withdrawn from publication, right? And that actually happened to be a big problem, because now they have, all of those progress they made the past few months in terms of getting this document, in terms of publishing this document, it's all going to, go back to where it was. And none of the help that these patients got initially are actually going to be worth it, or actually going to have any value for them because of what is currently going on, right? So this controversial therapy is actually something called graded exercise therapy, right, which is also referred to as GET or GET. And it involves incremental increases in physical activity to gradually build up tolerance, right? Essentially, you're going to ask these patients to exercise more, because maybe that way they'll build up tolerance, right? And that is one of the biggest problems. Now make sure you stay tuned, because we're going to head into a small break, and after that we will be back to discuss this. But obviously, until then, make sure that you stay tuned. Welcome back to the show. It's your girl Sarah right here on Relaks Radio, and I'm super excited to be here because we're having a very important and interesting conversation, I might add, with regard to chronic fatigue syndrome. How a publication that was actually supposed to be published, that actually gave guidance on how exactly to deal with the chronic fatigue syndrome, or ME, has actually been withdrawn, right? And now that's like one of the biggest problems for a lot of these patients and charities that are focused on chronic fatigue syndrome, because it means that they have to go back on all of the progress they made in terms of getting health, in terms of, or rather in terms of getting help, and in terms of getting treatment to actually treat these chronic fatigue syndrome patients. All right. So that is what the conversation is about. Now, before we actually head into the conversation, I want to very quickly remind you that you can, in fact, be a part of the show. So don't be shy. Let me know what your thoughts and opinions are. Share your thoughts, share your opinions with me, because that would be absolutely amazing as well. Okay, and something else that you need to keep in mind is you can go like us on Facebook and follow us on Instagram, Twitter, and TikTok. And don't forget to go subscribe to our YouTube channel either, because that way you can actually make sure that you're always informed and updated about the very latest that happens, not just in the United Kingdom, but in fact all over the world as well. And don't forget to download our app either, because that's going to be absolutely amazing, and it's definitely going to help not just you and I, but in fact everyone else to be updated about everything that goes on as well. All right, and now let's actually head into our conversation, because we were talking about ME, or even it's just also commonly known as the chronic fatigue syndrome. All right. Now, patient groups have, like I said, have suggested that this therapy called GET essentially involves incremental increases in physical activity to make sure that that patients have more tolerance, right? And chronic fatigue syndrome, which is said to affect about 250,000 people in the United Kingdom, has also been estimated to cost the economy billions of pounds annually. All right. And to very simply tell you about the characteristics of this, chronic fatigue syndrome, it's basically characterized by pain and also long-term debilitating loss of energy. All right. So imagine when you wake up in the morning, you always feel tired, or you can't even walk from, one room to the other because you're so tired, and you feel very fatigued, like you feel like you don't have any energy at all, right? And basically what happens is that it affects 1 in 4 sufferers so severely that they're unable to leave the house and frequently even their bed. Okay. And that is in fact one of the biggest problems, right? Because imagine being in so much of pain that you can't even move, but then you have this therapy, then you have this treatment that exercises you to physically exercise, but it's so painful for you to even move off or get off the bed, but they're asking you to exercise. Like, that makes no sense. You know what I mean? So that is why this is causing a lot of backlash, and this is why it's causing a huge problem here in the United Kingdom, right? Now, other symptoms of this can actually include mental fogginess, light and noise sensitivities, and trouble with memory and sleep. All right. Now, at the time being, for the time being, there's actually no specific treatment that actually exists. However, even though that's the case, having treatment like GET might actually not be helpful, right? Because they have actually recommended GET and cognitive behavioral therapy, which is known as CBT, and they've been used to manage these symptoms, but it's only been an attempt and it hasn't really worked out. Because some scientists and medical groups have actually argued that when you use these two approaches, they're only based on evidence, right? And they're based on creating treatments for this condition. However, patient advocates have fiercely opposed this, and they've said, in particular, especially GET, that a lot of these patients have been feeling much, much worse after receiving the therapy. So that is what the conversation is about with regard to, ME or the chronic fatigue syndrome. And please make sure you stay tuned, because we're going to continue this conversation after this small break, but we're going to head into a small break now, so make sure you stay tuned.
The valuations that you place on an asset are always behind you. It's always in hindsight. It's never in front of you. And that's one of the challenges, right? Because you're always valuing what happened yesterday, and what you need is what's going to happen tomorrow.